I am Lisa Letterer. I'm a certified nurse midwife. I would say that my biggest job is to make a place for you that you can feel comfortable giving birth in. The midwife exudes confidence in the whole process. I mean, I've had a midwife myself, so I do know how it feels to be cared for by a midwife, and their care just makes you feel like you're doing great, everything is fine, and so your anxiety just goes way down, and all you concentrate on is the work you have to do. You don't have to worry, is the baby okay? Lisa says the baby's okay.
Right.
I don't have to worry about it. The baby's fine. I can just labor and give birth. And I think that without having that constant presence, I think in the hospital, it's very easy to begin to believe that this is precarious and that at any moment something might go wrong. Our clients are allowed to eat and drink in the hospital. Everybody gets to be out of the bed. Nobody has to stay in the bed, and of course the tub. So, we are water birth in this area. Like, we have done more water births than anybody. We're the most confident water birth providers in the whole region. Typically, women who come to midwives are women who are already very interested in directing their own lives and making their own choices for themselves and for their families. A lot of it starts in the very beginning with their education. So the first thing we hand them is a book about normal birth and women having all different kinds of labors, but, getting through it, delivering their babies, whether it took 2 hours or 2 days. We're not doing natural childbirth to prove that you're some sort of superwoman and you're not, it's because of the side effects of all the treatments. You get an epidural, you can no longer move. And I don't know that people know that. All the muscles inside of your pelvis, inside, that direct the baby and help it make critical motions that get it out of your body, they just lay there. But your body is actually, when it's not numb, able to do all that and help you get the baby out. And I tell people, pain makes women move. So they assume positions that make it less painful, and amazingly, the positions that they assume that make it less painful is exactly the position they need to be in to get the baby out. Every time a woman gets poked with a needle or prodded, or another person comes in with the ultrasound to make sure, everybody's got to make sure, her fear goes up, and fear is the opposite of labor. So in nature, if you scare an animal, her labor will stop and there's no progress in labor. And although we aren't animals in nature being attacked by a wolf, a lot of times our bodies perceive what's happening as danger and wonder, we can't let the baby out here. She's terrified. So your body won't allow labor to progress because the woman's afraid. So you've got to always deal with fear. And there is absolutely no awareness of that in medicine.